It's a YP Thing podcast. I'm Pansy Johnson, and I'm all about encouraging, educating, and elevating young professionals. And on this podcast, our mission is to impact the next generation of leaders through authentic conversations and real life experiences. Y'all, welcome to another episode of the Leadership Corner series. I'm super excited about this episode. If you don't know, in May it's Women's Health Month, and so we are going to be having a guest speaker in honor of that. And also this week was Black Maternal Health Month, Health Week as well. So I'm super excited about both of those things. And today the guest speaker, she is full of knowledge. She's also a OBGYN, and she's going to be sharing her story with us. But before we jump into that, I want to share a little bit about her, about her background and who she is. So Dr. Tochi Keeton, she is the owner of Healthwise Wellness Direct. She's a dual board certified OBGYN and obesity medicine physician. She's a dual board certified obstetrician-gynecologist and obesity medicine physician. She has a subscription-based patient-centered medical practice focused on prevention, personalized care, and direct patient access. She is an alumna of Prairie View A&M University, where she graduated in summa cum laude in biology. Her medical degree and residency was completed at the University of Texas Medical Branch. And also she is a wife and mother of two with a passion for travel and history. So without further ado, I would like to welcome Dr. Tochi Keeton.
Thank you for having me.
Absolutely. Thank you for being here.
Absolutely. Congratulations to you on this podcast.
Thank you. Thank you. So what you all do not know, I met Dr. Keeton at a Little Rock Chamber event for the very first time. And of course, at that time, I did not know she was an OBGYN. I met her. I thought she was so beautiful. I'm like, I was like looking at her skin. I'm like, she's such a beautiful woman. So I sat down. So just like she's smiling now, she was smiling then. We just hit it off. And then she told me about what she does. And I said, oh my gosh, we got to get together. Remember, I was like, we got to get together. And I didn't know when that was going to happen. And now she's on the podcast. So I do want to say too, I hope that that also encourages you. You never know when you are crossing paths with someone, you never know when you're going to cross paths again. And so, just be intentional when you are, meeting someone, because you don't know where the introduction can lead you. So I'm so happy it led us here.
Yeah, we had that talk. Networking is so important.
Yes. And I think that was a pitch contest and you won, right?
Yes. That was a couple of years ago.
Right. So she's just doing phenomenal things, located in Palm Bluff, Arkansas, just doing phenomenal. And we're going to get into that conversation today.
Yeah.
So, okay. So the first question I have is, first, tell us where you're originally from and what led you to, when did that interest start for you into medicine and specifically women's health?
Okay. Well, I was born in Nigeria. I moved to Houston, Texas when I was about 6 years old, grew up in Houston, went to undergrad at Prairie View A&M, just an hour or so north of Houston, and then went to medical school an hour south of Houston at University of Texas Medical Branch. So, gosh, when did the interest start? I think, I probably, as long as I can remember, I always said I wanted to be a doctor. And I really don't know where that came from. I like taking care of people. I'm the oldest of 5. So I always kind of was a nurturer, liked getting things better. I liked school. I liked science a lot. And I just knew I was going to be a doctor. So I just kind of got on that path and never looked back. So that's really my story. That's where it kind of started.
And I started.
Yeah.
I love that. I'm actually the oldest of 3 on my mom's side.
Okay.
And so I know. When you're the oldest,
The child, oldest daughter, especially.
yes, you set the standard.
Yeah.
You set the standard because your siblings, whether they admit it or not, you're always looking up to you and setting there. So that's phenomenal. Also, there's also a lot of weight there too.
Yeah.
To be successful or to accomplish something, so that they do know that they can do anything they put their minds to. So, and you've done that. You've done that. So I want to ask you, how would you say your academic journey shaped your discipline and approach to excellence in your field?
Yeah, I think, well, probably everybody knows this. Medical school is a lot of schooling. So I went to graduate from high school, then did 4 years of undergrad at Prairie View, and then 4 years of medical school, and then for obstetrics and gynecology training, did 4 years of residency. So lots of academics. So it really did take a lot of dedication to book work. But I had a lot of people who encouraged me along the way. So at Prairie View, I think I graduated from Prairie View really long time ago. But I think I could still go back to the campus of Prairie View today, and there would be professors who knew me by name.
Right.
So it was a very nurturing environment. It was a family. I had people around me, people that I'm still friends with today, who I went to Prairie View with. We studied together, we cried together. We kind of grew up together. So it was an environment that really nurtured me to go on the path that I was set to go forward with. And I have friends who went on to medical school, dental school, veterinary school. So we knew what we wanted to do, and then we had people around us who were doing the same thing. So it just felt normal. It didn't feel like we were doing anything extraordinary, because everybody was doing it there. So I was really fortunate to be at HBCU that encouraged that, and I've really nurtured that.
Right.
And I've to think about it, I've really had that along the way. In medical school, I had a group of friends that I studied with. I had people who encouraged me, people who I rotated with, who looked like me, who showed me that, hey, if I could do it, you could do it too. So that really helped along the way. Yeah.
That is so good. And I love that. I love hearing, like you said, your environment.
Yeah.
That is so important, in your environment. And I want to take that moment, to pause and also encourage the young people that are listening. Sometimes you have to stop and ask yourself, like, the people that I'm surrounding myself with, are they pushing me to where I want to be at?
Yeah.
Because that's what I'm hearing from you. Like, you, not only did you go to a university that was great and that pushed you forward, but also your environment, the people that you were around, they were also on that path.
Right.
And you also, it is easy. You're right. It is easier to stay focused when you are around people who are like-minded.
Right.
That's it. So get around some like-minded people.
Yeah, you're right. It makes a huge difference.
Right. So you transitioned from traditional healthcare. You launched your own practice. But before we jump into that, I want to talk about your time in traditional healthcare. And how was that going from, college and, oh my gosh, you went all that school, and now you're ready to enter into the real world, in the sense of like starting what you went to school for, and actually putting that into practice. So let's talk about that transition. How was that?
Gosh, okay. So I say, people ask me, like, how did you get to where you are today? Well, I really, going from undergrad to medical school to residency, those paths were already kind of set. And there's a standard. You go to school, you get this GPA, you take this exam, you take these classes. Everything was kind of already like in a rubric. So I followed that path, and then like naturally after I finished residency, I took a job, because that's what, people who graduated with me did. They took a job in traditional practice. Like private practice was kind of, phasing away at that time when I finished residency. So I took a job working as a traditional OBGYN. Loved it. I moved to Pine Bluff in 2016 for that job. So I started working. I was really busy, being in a rural area, small town. It was great. Like, I knew all my patients. Like, I knew their backgrounds. I knew their families. I got to really know them and kind of take care of them through pregnancy, when they came in for, other issues. So it was great. I was just so busy that I was like, okay, is this what I'm supposed to be doing? Am I supposed to be kind of still running around like I was doing when I was in residency. Residency is a really busy time. You learn a lot, but you work really, really hard. And when it came time for me to renegotiate my contract, I was thinking, well, I really do like my patients and I love what I do, but am I taking care of myself? Am I growing in my profession? Am I growing in my other passions? And I really had to kind of step back and think, okay, everything that I've done so far has kind of been already a set path for me. What do I really want to do?
That's good.
What do I really want to do? So it took me a few years to figure that out. I continued to work, and I worked in a different environment. I worked as a OB hospitalist where I covered the hospital at high acuity hospitals so that the traditional OB-GYNs could get a break. So when I worked, and then when I was off at home with kids. At that time, I had one son, and then I had my other son during that transition. And I always missed that long-term connection with patients, though. So I was like, okay, how do I get a balance where I can have that, but still have the me time and time for family and kids and to grow in my other passions.
Right.
And that's really where the journey to Healthwise started.
Wow.
And that's where I started kind of trying to design a private practice that worked for me and worked for my patients.
So good.
Yeah.
So good. I love that you also touched on the fact that you went from being in a city, in a sense, to rural.
Yeah.
How was that transition?
Gosh.
And I know it was school, but how was that?
Yeah, it was very different. It was very different. So I grew up in, but I've had a lot of changes in my life. I actually started in a rural place where I was born in Nigeria. I lived in a place that was rural, very community oriented. Then moved to Houston, where it was obviously Houston is a huge city.
Right.
There's a big Nigerian community in Houston, though, so I did have kind of that connection. But everything you ever needed, you could probably find within a short distance in Houston. So coming from that and going to a rural kind of small town, there was almost something that felt like home doing that, because it reminded me a lot of being in Nigeria and the community there. And, everybody kind of knowing each other and knowing people's family backgrounds and all that. So there was just something kind of endearing about that. So it was different, but I adapted pretty well to it.
That's good. That's good. I was wondering. I'm like, how they transition, but
Definitely a quieter life than when I was in Houston.
Right.
Yeah.
The busyness all the time.
I think I needed that at the time, actually.
And so
I needed that after the hustle and bustle of schooling and residency training and all that. I kind of needed that. So it was perfect timing.
so good. I love that. I love that. I come from a rural background, grew up in Fort Hays, Arkansas, super duper small town, and community. Like you said, that's the thing that sets the rural areas apart. Is that community? That community. So we always talk about low to moderate income, all those things, and yes, those factors and lack of resources. Yes, those we're not going to deny those, but the community piece, it's way different. It's way different. So I love that. I love that. What are the gaps that you've seen during your time just in traditional healthcare? What are some of the gaps that you've seen in the healthcare system that also piqued your interest in developing your own private practice?
Yeah, so just from the patient standpoint, when I would see patients when I was in traditional practice, I felt like the visits were really rushed. And I did my best to try to kind of get to know the patient, get to know their medical history, their personal history, as that impacts, if I get them a recommendation, but they've got these kind of stigmas in their mind about traditional practice, for example, they may not follow the prescription that I give them. They may come back, in 2 or 3 months and still have the same ailments that I was trying to treat. So getting to know the patient really affected my ability to treat them. And I didn't feel like I really got to dive in to that aspect that I thought was a missing piece in being able to care for them. So my visits would be so rushed, and I felt like I really wasn't taking care of them as well as I could. So that's from the patient standpoint. From a personal standpoint, I really felt like I wasn't able to develop professionally in the level that I wanted to. I have a pretty creative mind, and we'll kind of get into the practice, and I didn't feel like I was nurturing that. I didn't realize that until later on when I really started exploring the practice. So those were kind of some of the things that were missing for me in the traditional practice.
I love that. I love that you just being able to experience that and then learn from it and like predetermined, actually be able to learn from it and start to implement it in your own practice. So let's talk about that. You talked about it a little bit, but let's talk about when you were in that moment where you were like, okay, yes, I'm going to do this. I'm going to start my own practice. That's not an easy thing to do. How did you make that decision in that moment?
Yeah, so it was probably a series of moments that led to that decision. I think I always knew that I still wanted to have a practice where I followed people and got to really know them. I like that continuity of care. So I started researching how to open a private practice. I didn't learn how to run a business, how to open a practice when I went to medical school. People assume, doctors have practices and they know the business side of it. I didn't know any of that. We didn't learn that when I was in residency. We learned all of the medical things. I had great training, but I didn't get any business training at all. So I didn't know how to start a practice. I was like, I've seen practices. I have no clue how to do it. So I actually just got off Amazon and I ordered a bunch of books on private practice. And at the time I was traveling for work, I would, cover as a obstetrician in rural places or places that were kind of remote who needed coverage. So I would do that. And when I was flying on the plane, I would listen to a podcast. I would listen to a book. And I ordered a book on private practice, thinking it was just, about the traditional private practice. And I think I carried that book for a couple of months. And during one of my flights, I had a long flight. I just read the book and I was like, a subscription plan, a membership-based practice, that sounds kind of interesting. And, everybody's kind of familiar with subscriptions. Amazon, Netflix, gym subscriptions, everybody's kind of familiar with that, but I had never thought about the idea of having a subscription for a medical practice where you pay a monthly fee and that you get unlimited care. Like that, that was just, I guess it was just something that I was looking for that I didn't know I was looking for.
Right.
But then I put that book down and I was like, I don't know how that would work. Like, it seems almost too simple. Because when I was in training, even though I didn't learn about business, I heard about insurance coding all the time. You do this to get paid. You got to know about billing and coding. Everybody was always talking about billing and coding. And I kind of just tuned it out because I didn't want to learn about it. I wanted to learn about taking care of patients. I didn't want to learn about billing and coding, but you can't get paid. If you don't get paid, you can't run a practice. So I think that was actually the scariest thing for me about opening a practice, because I was like, well, how do I do the billing and coding thing that I've honestly ignored for all those years in training? And I didn't want to learn about it. So when I learned about this subscription plan, I was like, this is pretty simple. A contract between me and the patient. This is exactly what I need. And then I get to take care of them and they actually get quality of care from me. So it seemed almost too simple. So I read that book and then I thought about it. And then I actually, what really helped me to kind of move forward was I found other physicians who were doing it that were thinking it. So, and I reached out to them and they were gracious enough to kind of share how they did it and how it works. Every practice is different, but they showed me what they did, and they were willing to share, and that was refreshing. Just the fact that these were physicians who were happy with what they were doing. Right. They were so happy about it that they wanted other physicians to do it. I went to a conference where I learned more about it, and then I just started developing my practice and how it worked for me. I knew what I wanted to do for my patients, so I started building that.
I love that.
Yeah.
I love that. And what stood out to me is that you did the research yourself.
Yeah.
We don't talk about that part. We want to do something and then we're like, trying to find people that, no, you have to do the legwork yourself sometimes. You need to research. If you have an idea or it's something that you're interested in. Matter of fact, I was just talking to my sister. She was telling me that there was something she wanted to do. I said, have you did your research?
Yeah.
It's so important because in that research element, you're able to understand your own self, and which ended up leading you to, yes, it's okay to reach out to other people and get assistance and help like you did, but also that piece of research, yourself that you did. Kudos to you, because that's not easy, and you're working.
Yes, I was working and mothering and all of those things. So, but Nancy, I'm still learning. I feel like that research never ends. I'm still learning. I'm still developing. I'm still growing. Recently, I thought about, those days when I was planning the practice and what I wanted from it. And I've had to go back because I'm like, okay, some of the things that I've done have kind of taken me away from that path. I've got to get back to the original reason why I was opening the practice, the things I wanted to do. I've got to have that checklist and make sure I'm referencing that and doing what I really did this for.
Right. I love that. The why. Going back to your why. Sometimes you just need to go back to the basics.
Yeah.
How would you say that the subscription model that you implemented, how does that affect, I guess, the relationship between the doctor and the patient, having that subscription model?
I think it's just great. It's great because now, when my patients need me, they could have access to me. And I built a practice where I have the time to give them that access. So for example, like in a traditional practice, OBGYN might have about 3,000 patients on their panel. And if they're seeing, an average percentage of those patients a day in their practice, they may be seeing 20 to 30 patients a day. So that's why, when you go into a traditional practice, you may see a waiting room with, that many patients there. In my practice, for example, we may have like 8 to 10 patients a day coming in. And that's probably a busy day. And then when my patients need to text me, ask me a question, they don't have to wait 2 or 3 months for their next appointment. They can text me and they actually get a response from me. They can call me if they forgot to tell me something during their appointment, if something comes up in between visits. So it's just more of a personalized relationship. They have the time. We don't feel rushed. We're actually able to get to the bottom of the concerns and issues that they have. I think it's really been life-changing for me, being able to take care of patients on that level. And it's been life-changing for my patients as well.
So good. I love that. So prevention is at the core of your practice. Why is it so critical, and how can patients become more proactive about their health?
I think really education is a big part of my practice and a big part of prevention. So I get a lot of patients who, when I was in the traditional setting, I had patients who would come in and they would have bad outcomes, not because of anything that someone did, but maybe they had a symptom that they didn't realize correlated to a certain illness, so they ignored it, or they chopped it up to something else. Maybe they had a doctor's appointment where they didn't get a chance to talk about that symptom, and it was really the main thing that was bothering them. But when they saw their doctor, there was kind of a checklist, and we were kind of going through those things. But the issues that they were really concerned about, we didn't get to them in time. And I've had patients who had bad outcomes during pregnancy because there were concerns or health issues that they had that weren't addressed because they just didn't know. They didn't have the access to a clinician who could explain that to them. They didn't have the knowledge. Or they just have somebody who they felt comfortable talking to, who would listen to them. So I feel like, when I built the practice, I developed an environment where patients don't have to go through that, because if they have a question or there's something that's concerning, either they ask me or I know them well enough to where I'll ask it.
Exactly.
So it really helps to prevent a lot of disease states that are preventable that people haven't had an opportunity to address previously.
So it's so good. Are you jumping the gyms? You're educating us too, and I think that's so important. And you touched on something. You said a lot of just pregnant women, sometimes they just don't know, right? You don't know what you don't know. And I want to, which is a perfect segue into this next question, because I mentioned at the beginning, this is in honor of Black Maternal Health Week. How do you view the current state of maternal health for Black women, especially considering we are over 3 times more likely to die from pregnancy-related causes in the United States?
Yeah. I think a big part of the discussion that I think people don't highlight enough is that it's from preventable diseases, right? So there's certain things that happen that we don't have control over. But when there is a preventable disease that we don't address, that is an area, that's where we can get our biggest bang for our buck. So we know that when Black women have providers who look like them, they have better outcomes. There's a lot of reasons for that. So when we focus on the things that we actually can identify and prevent, giving women better access to care, paying more attention to some of those subtle things, like if we're starting to have some blood pressure elevations, letting moms know, hey, monitor your blood pressure. This is how you monitor your blood pressure. Letting their community know, their spouses, people that are around them know, hey, if she's complaining about a headache, don't ignore that headache. If she's having some vision changes, don't ignore those vision changes. These could be signs of preeclampsia. Educating the patient and educating the people around them is really one of the ways that we can actually help to improve those outcomes. Then giving them better access, giving them more access, not these rush visits where we're ignoring the subtle signs before they develop into something major.
So good. So good. And I love hearing that, because also, you're a Black woman. You know what I'm saying? Like, just when I heard that you was an OBGYN, like when you told me, that touched me. You know what I'm saying? Like, I feel like also being a Black woman, I actually just read something, and she said I can share it. My good sis Aaliyah, she actually just had a baby boy. And she was saying how she was 36 weeks. She was 36 weeks, and she waited. Like, she waited to, until her body allowed her to, like, the water to break so she could have the baby natural. And she ended up having him, I believe, at maybe a little bit after that. It was a little bit longer, but the reason why I bring that up is many patients, and I would say definitely Black women, struggle with maybe even advocating for themselves, right? Some of them are, informed to go ahead and have the C-section, or, the baby isn't turning out. And so I want you to kind of educate us, definitely from the physician point of view, right? But also how Black women, but just women in general, it's okay for them to advocate for themselves in that time space. Maybe where they may feel like, okay, can I say, you know what I'm saying? Can I wait? I want to do this natural. This is something I really want to do.
I think, even before we get there, right? If we built a relationship where you feel like you can trust me as your healthcare provider, we're not going to get to a place where you're wondering at that last minute, are the recommendations that I'm giving you to your best interest, right? So of course, I've as an obstetrician and gynecologist, I've done deliveries that have been just perfectly smooth, where I'm like, just put a glove on, the baby slides right out. I've done deliveries where I've had to kind of be there to rescue a baby that was in distress, to rescue a mom that was in distress. So I've seen all of those things come, and our job, I tell patients this all the time, y'all do all the work. Y'all can, you can deliver a baby by yourself. We're there for the times where things are going wrong, So I can get a baby out probably within 30 seconds, in the operating room if needed. But that doesn't mean that is the quickest thing is not necessarily the best thing for the patient, but I do appreciate that my patients have access to that, because if you didn't have access to that life-saving procedure, that can put mom and baby at risk. So It's a fine balance. I think before we get to a situation where my patients are wondering, am I giving them the right recommendation? I have to build a relationship where they trust the things that I'm saying and telling them. So not only is advocating for yourself something that you should do, it's something that's necessary. You have to be in a healthcare relationship where you feel like you can advocate for yourself, because you have to. You have to, and you have to be with a provider who knows you, who understands you. And if you can't advocate for yourself, you have to have people around you who can also. So if you feel like you're not, your voice is not getting heard, you're not comfortable, you probably need to establish care with a place where you can do that. It's necessary.
Right.
Yeah, it's absolutely
So good.
Yeah.
And I can tell already that you allow your patients to do that.
Yeah.
You know, like
Yeah.
you want to create that space for them. And it's so important to have a physician, OBGYN, that is allowing you to do that. So definitely if you are feeling that hesitation, you know, don't be afraid to advocate. So I'm here, don't be afraid to advocate.
Yeah.
If you do need to change it and it's early on, maybe do that, you know, so it is such a big moment. It's such a big moment, and you definitely want to have someone that you truly trust.
Yeah.
Trust.
Yeah. Because not advocating for yourself could put you and your baby at risk. So, it's childbirth is a beautiful moment. I always tell my patients I'm privileged to be part of that. With them. So, if you are not advocating for yourself, that moment really can take a turn. So you have to.
So good. So good. I love that. What does leadership look like in the healthcare space today, especially for physicians building their own practices? So you build your own practice. What does leadership look like to you?
Oh gosh, so I'm still learning, right? Because like I said, I didn't, have I've read the books and I've taught the practices, but my practice is unique. It's my practice. My patients are unique. The outcomes that I want for them are very specific. Like I built a practice where I can provide whole person care for my patients, from obesity care to menopause care, childbirth, and helping them to prepare for childbirth, fertility. So that's, unique in itself. That's unique in itself. So for me, leadership means that I am constantly evaluating to see if I'm meeting those goals, if I'm building a team around me, and training my team to help meet those goals, and if I'm, making sure that I'm meeting the expectations of my patients from that standpoint. Because patients come to me because they want to be part of that community where we're taking care of them as the whole person.
Right.
My patients know, I tell them, hey, it's not a quick fix. If you're coming to me to get to the healthiest you, we're going to have to work as a team. It's going to take time. It's going to take, us building a treatment plan that's specific for you, evaluating that treatment plan, implementing it, and seeing, are we meeting our goals? That is that's not a quick fix. So I have to make sure that I'm developing in the skills to be able to deliver that to my patients, and then also building a team that allows me to do that. That's a day-to-day struggle.
Yes. Yes. And but you do it so gracefully.
Thank you.
You do it so gracefully. What would you say the 3 biggest lessons you've learned as you think of, oh my gosh, from college, from transitioning to traditional healthcare, and now owning your own practice, and just like what you said, pouring into your own staff? What are the 3 biggest lessons you've learned being in medicine as an OBGYN? Yeah.
Okay. Biggest lessons I've learned, teamwork. That's the first thing that comes to mind. And so healthcare, there's a lot of teamwork from, from the clinical staff, the people taking care of the patients, the receptionists, the medical staff, even the administrative staff. We all kind of work together to deliver outcomes to our patients. So I think I've learned a lot about working with people as a team, being a leader of that team. In the operating room, everything falls on me. I'm the leader of that team. So I've learned to work with different styles of people. I've learned to develop my leadership style and my leadership skills, and that's not something that just kind of comes naturally. It's something that I've had to do work with, because I realized that affects our bottom line, it affects our patient outcomes. So learning about myself and personal development, and then learning how to be a better leader has really helped me with developing the practice into what I want it to be.
I love that. What would you say, I guess, just as you were talking, this question came up, like, what would you say, just your practice, how has that, especially being down there in the rural area, there's other practices. What has set you all apart from, I would say, the traditional healthcare?
Yeah, so, although we're located in Pine Bluff, we see patients across the country. We provide telehealth care for women's health and for obesity care. So we actually see patients all over. I think, in our community, specifically for our local patients, our patients here in the state of Arkansas, patients in Pine Bluff, what sets us apart is probably what sets us apart to patients across the country, the personalized care, the fact that they're able to have access to a trained physician who can develop a treatment plan for them. Our patients like that they have better access to us. In our community specifically, there are patients who wait, 3 to 6 months to go see a specialist. Our patients don't have to wait that long. When our patients have a concern, we can address them right away. And we can actually see them to see if the things that we're implementing, if they're working. So I think that people are recognizing that taking that time really does make a difference in their outcomes, and they're getting huge results from devoting that time to their healthcare. I think more of our patients are health conscious. A lot of people are health conscious from a nutrition standpoint, for medications. Like, it's not unheard of for me to prescribe a medication and then take about 15 to 20 minutes talking to the patient about the way that the medication works, how it may work in their body, side effects that they may have, and kind of doing that research for my patients. I've had patients come in with bags of herbs that they got from the health food store, and we sit there and we look at the herbs and we talk about how it interacts with some of their other medications. We talk about some of the side effects. Sometimes side effects can be a benefit to patients, and we use the side effects for their benefit. So really, it's like artwork. Like, we're, it's not a catch-all. Like, there's not, I don't prescribe the same medication for every patient because everybody's different. And so I do want to know what herbs they're taking. So I'm grateful that they bring those in, because some of those herbal supplements can actually affect the prescriptions that they have, and maybe even more powerful than some of the prescriptions that we write. So I want to know what my patients are taking. And if there is an herbal supplement that is beneficial, I want to be able to give them that recommendation. Yeah.
So good. Oh my gosh.
Yeah.
I found my OBGYN.
Yeah, our patients love it. Our patients love it, and when they find, when they find the practice, they stay and they love it, and they bring their friends, because it really is that life changing for them.
Wow.
Yeah.
The care that you're giving, like, this isn't just a job for you. Like, you literally are listening to them, and also educating them in a sense, right?
Yeah.
And they feel comfortable enough to come to you.
Yes. Yeah.
Dr. Tochi, keep going. Like, that's outstanding. That's outstanding. What advice would you give in regards to, we're going to have a lot of young people that's listening, a lot of young women that may even be about to be first-time mothers. What advice would you give of how important women's health is, even before you get to that stage of being pregnant, how important is women's health?
Yeah. So we have these visits called preconception counseling visits. So that's for anybody who is considering conceiving within the next year. Before you conceive, go into your OBGYN. Have them just do your wellness exam from a mental health standpoint to a physical standpoint. Get those pap smears. If you have other medical conditions, let's make sure that we're optimizing caring for those conditions. Let's plan for the pregnancy so we get better outcomes when we're able to plan.
Right.
Bring your spouse in, your partner in. We can kind of talk about what to expect. So those visits are really important. And I see a lot of women who come in and they maybe were trying to conceive. I've had some of my patients who come in, and these are probably one of the most heartbreaking visits that I have, where patients have tried to conceive for years and they were not successful, but they were not able to have that conversation with a clinician before it was too late. Those are really heartbreaking visits because they didn't know that they could make an appointment specifically to talk about that. They didn't know that, that burning desire to conceive was a medical issue that they could have discussed, and there were things that we could have done to evaluate for it. So those preconception visits allow us to capture all of those things to help women prepare for pregnancy, help families prepare for pregnancy, and achieve better outcomes.
So good.
Yeah. So if you're thinking about getting pregnant, make a doctor's appointment so that you can plan for it. Yeah.
Right. Yeah. Oh, wow.
Yeah.
That's good.
Yeah.
Because I feel like even now that I'm getting older, like the things that I did not really focus in on before, I focus in on more now.
Yeah.
Like even from skincare, like taking my vitamins, just all those things that you don't, like when you're younger, you're like, I don't need that.
We're all like that.
Making that more of a priority as you go.
Yeah, and you can start to kind of adapt the environmental factors that can affect your ability to get pregnant and can affect your pregnancy outcomes now before you get pregnant. So those visits are super important.
Wow, what are some of the biggest things that I guess just some of the biggest challenges that you see that are affecting those? Because you talk about environmental factors. Like, what are some of those factors that affect women?
Okay. One thing that stands out for me is stress. So in our practice, we do focus a lot on mental health and stress, and finding ways to decrease stress. Because a lot of my patients, stress affects everything for them, whether it's like societal stress from their socioeconomic background, racial, if it's stress from their work environment, all of those things. And then some of the things that people don't identify as stressors that really are stressors, relationships, jobs, education, all of those things. We try to create a space where people can start to identify those things and then teach them skills to reduce the impact of that. So that's just kind of one of the things that comes out to mind.
So good. Oh my gosh, you've given us, literally educated me.
Yeah.
You've given us so much good advice. But what I'm hearing, the biggest thing is, like you said, get ahead of it. Like, go to your annual visits. And like you said, if you are planning on, that, hey, you and your significant other are trying, and maybe trying in the future, don't be afraid to go ahead and talk to your OBGYN, your gynecologist, your physician, and just go ahead and make sure that you are in a good place. So good. I love that. So tell the listeners, like, where they can learn more about everything that Healthwise Wellness is doing.
So you can go to our website, www.healthwisewellness.com to learn more about the practice. You can follow us on social media, on Facebook, Instagram, TikTok, all of the things, Healthwise Wellness Direct. And we're always out in the community too, sharing some things that we're doing. We're always doing community events, whether it's like walking events that we do to teach people about wellness or health fairs. We're always networking. So lots of places to find us. We do some corporate wellness programs as well. So if you feel like our practice is something, and we've had patients who have referred their employers to us because they felt like the practice was really helping them to meet their health goals. They were getting their blood pressure down. They were losing weight, achieving health goals that they had been trying to achieve for years. So we've had some corporate partnerships because of that. So you can find us on our website. You can reach us by traditional phone, 870-454-4354. As our practice line, and we're available.
I love it, and you'll be in great hands. Yes, I follow you all on social media. I'm like, yes. Very active, and I love it.
Social media is a great way for us to educate our patients too. So I try to utilize that.
Yes, you're doing great and great things. You definitely educated us today on the importance of women's health. You see it, you live it. You're dealing with women every single day, and so thank you for even taking your time to come on. But I do have an additional question. Before I transition to the last question, I have one more question. When you think about the long-term impact of Healthwise Wellness Direct, what legacy are you hoping to leave in healthcare?
Gosh, I think, from when we started the practice, I thought that when I opened a practice, it needed to be just a cookie cutter, traditional practice. That's all I really saw. But when I developed this practice, I realized that I could fill the void. I could actually treat patients and get results from it. So that's been really fulfilling for me to be able to do that. To identify a problem and actually be able to solve the problem. And I think a lot of my colleagues are people who naturally are problem solvers. But in the traditional practice, we haven't been able to do that because there's been just a lot of complexities and bureaucracies that kept us from being able to actually take care of patients. Most people who went into medicine really, truly want to take care of patients.
Right.
And along the way, things have gotten so complicated and complex that we've lost that simple touch of being able to just take care of patients. And I think that my practice has allowed me to get back to that. And I'm hopeful that will encourage other people going into medicine, to begin to look at different innovative ways that they can deliver care to their communities. So that's the legacy I hope to leave.
So good. Yeah. Okay, one last question. For someone aspiring to enter medicine, feel something of their own, and they're in a moment where they're feeling uncertain about that, what would you want them to know about their ability to succeed and make an impact in medicine?
Gosh, you can make an impact. One, you have to find a mentor. You have to find a mentor. I think that's kind of where it starts. Somebody who's done something that you want to do. And it doesn't have to be the exact thing, but somebody who can kind of at least encourage you and show you that it's possible.
Right.
And then you have to stick with it.
Right.
You have to stick with it and continue to develop and grow and remember while you're doing it.
Right.
So you can always come back to it.
So good. So good. Well, thank you so much, Dr. Thank you for coming on. I appreciate you. Continue to do what you're doing. I am just just mind blown at just the amazing woman you are, but also the amazing physician and gynecologist you are. So just continue going. You have a supporter in me. This is It's a Wacky Thing podcast. It's all about encouraging, educating, and elevating young professionals. Our mission is to impact the next generation of leaders through authentic conversation and real life experiences. Y'all, this is the Leadership Corner series. I say it every time. It's going to get better and better and better. And this was Dr. Tochi Keeton. We'll see you next time.